Yeah, I'll just jump in. I just want to add a piece about the housing. So we just worked with Illinois Housing Development Authority and Department of Corrections to get out about $4 million for transitional housing, a pilot to rethink about some transitional housing strategies. And initially we were like, how do we bolster this to ensure that folks have what they need? So we're like, how do we have funding to make sure they have utilities paid and furniture? And we were doing this with private housing providers. They said that's fine, but what we really need to know is whether or not there's a commitment to having wraparound services and supportive services. And there was some myths about what DOC historically had been providing, right? They assumed that that was a part of the package, if you will. And, we had to have some intimate conversations, bringing in the Department of Human Services and the Department of Corrections. And ultimately, the bill wasn't written in a way where that was required. And we found ourselves in limbo. Now, I bring this up because Brian made a point. He said there are all these different types of things that are required, but there's been limited services around healthcare. Now, this has been a problem that continues to linger. There are statutes on the books right now. There's a requirement for people to be enrolled in Medicaid coming out of the Department of Corrections that was passed, I think, last year. There was a statute requiring folks to be enrolled in the Department of Juvenile Justice a few years ago. And these things continue to sit on the books. So when we talk about this moment, there's an opportunity to move forward with new legislation, but it's also an opportunity to ensure we get legislation that's been passed right. We recently, and I just want to say why this is important, we recently got a system set up within our Department of Juvenile Justice to ensure that every youth who comes out of there is enrolled in Medicaid. And 95% of them have a diagnosable mental health condition, by the way, right? That 95%. And out of all of them that were released within a certain month, within a month, 95% of them had health care in hand. That has not happened historically. So when we talk about the types of supports that the Department of Corrections needs, et cetera, we all need to work with Director Jeffries to ensure that this is happening for the 25,000 people who are leaving the Department of Corrections. Because if they do not leave there with health care in hand, and it happens in other states, then we're going to have significant problems around recidivism and positive outcomes.